If you will agree with me that these days a lot of people are depressed, there's economic recession, we've seen a lot of suicidal attempts. Some actually committed suicide. A very popular doctor, Dr. Orwell Oji, plunged into the lagoon, and after that, we started seeing the upsurge in people who are attempting to plunge into the lagoon. And I was asking a friend jokingly that if you know you want to plunge into the lagoon, do it at 12 midnight. Don't do it when those fishermen are around. But it was just a joking thing because it's not even easy to take that plunge.
In fact.
Yes. For people to have thought it fit that should be the next option, it means they have already been pushed to the wall. But must that be a solution to that? So, by popular demand, we've made it a point of duty to still say something on diabetes. The World Health Organization says that 100 million had diabetes as of 2015. But this year it has jumped to 505 million.
Wow.
And that's why you now see limbs being amputated left, right, and center. It could be you, it could be anybody else, who knows. But the best thing is to prevent it. If you can prevent it, prevention can come in many forms. But then, these are the people who are at risk of diabetes. So if you fall into any of these categories, you know you've got yourself to be checked. How do you know if you have diabetes? Excessive taste. When you always crave for water every time, water. You can finish a bowl of water within 5 minutes. Then you know something is wrong. Excessive hunger. You are eating like gourmand. Like Jennifer Asadaku. When you are eating as if you have been handed over a death sentence, you know. Excessive urination. You cannot travel within here and Ibadan. At least you will ask the driver to stop about 30 times. Maybe you should be using diapers, I don't know. But that's too much if you ask me.
No.
Unexplained weight loss. When you just go out and you are drying up, and somebody is now suggesting that it is the witchcraft in your village that are sucking your blood. Well, it may not be that. You better go and check yourself. Tiredness. Any little effort like this, you are asking for somewhere to sit down. You know, blood vision. You cannot see clearly. Please don't confuse my glasses with blood vision. That comes with age. Maybe that could be, that could be pathological. Slow wound healing. Tingling sensation in hands and feet. So, and certain conditions that can put you at risk of developing diabetes are these: overweight and obesity, high blood pressure, advancing age, family history of diabetes, physical inactivity. I think you have something there, Emma.
Yes, sir.
Yes, what do you have there?
We have some bit on diabetes. One of it is there's need for you to eat healthy. Always choose your meal plan and from your doctor or nutritionist in order to keep your blood sugar in normal control or under control. Then also take your medicine as prescribed by your doctor. You don't have, as a diabetic patient, you don't have to be taking anything anyhow. Yeah. Then you have to also check your blood sugar. Make sure it is tested regularly to maintain a healthy level. And also check your cholesterol. At least once in a year, you must go for a cholesterol test from a reputable hospital to prevent further complications. And then regularly see your doctor for eye test. And also have your blood pressure checked regularly. We are talking about those that are at risk of diabetes. Okay. And then make sure you also do a kidney function, because sometimes we forget all those internal organs. Kidney function test. Yes. Okay. Do your kidney function test regularly for you to know the proper action or how your kidney is functioning properly. Okay. The regular exercises must not be forgotten. You must try to exercise.
Talking about regular exercises, I think many of us are guilty of that, including my own self.
We don't really exercise like that.
Let's imbibe the culture of exercising. But if you want to exercise, I want to say this. Before you take part in any exercise activity, make sure you see your doctor so that you get your blood pressure checked. They can know the one that is suitable for you. And for those of you who are staying where we have plenty of Okada, you have to take it easy. If you want to play... you want to play Ben Johnson or you want to start running in the midst of Okada, your legs too will be amputated. But that may not be due to diabetes, but Okada. So you have to be very careful. If you want to do some jogging, make sure you are doing it in an area that is conducive, where we don't have the influx of this Okada, so that you can, do that regularly. It may not be everyday thing. What other things have you done?
We have to. Another thing here is avoid smoking. In fact, it's not even good for anybody. So you must not smoke.